Hello, it's Dr. Rhonda Johnson, and today is Sunday, February 19th, 2023. Today, I'm giving an update on measles, polio, and invasive Group A Strep. But first, I'm going to start with the measles outbreak in Columbus, Ohio. It is good news, folks. The Columbus Health Department has declared the measles outbreak is over. There have been no new measles cases after a period of 42 days, which is the equivalent of 2 measles virus incubation periods. So all in all, 85 children were known to be infected during the outbreak, including 36 children who had to be hospitalized. Now, all but 5 of the children were 5 years of age and younger. Fortunately, none of the children died, but 82 out of 85 children who contracted measles were unvaccinated. So remember, if you're exposed to measles and you're unvaccinated, 90% of folks will get infected. So please get your children immunized. Get the measles, mumps, rubella shot. All right, next is invasive Group A Strep. Remember, in the fall, there were children that were getting this infection, and some were dying in the UK. Well, the CDC says on their website that invasive Group A Strep infections in children have returned to levels similar to those seen in pre-pandemic years. So that's very good. Now, the CDC says their preliminary data did show that these invasive Group A Strep infection levels in children increased between September and November. But it looks like that has quieted down. And again, that is great news. Now on to the polio outbreak in New York City. Now, as of January 6th, according to the CDC website, the sequencing, testing, and analysis confirmed the presence of circulating vaccine-derived polio virus in a total of 101 positive samples in New York, signaling that the polio virus was continuing to circulate. But recently, an online newspaper reported that batches of recent wastewater testing in downstate counties showed no polio virus. But the health officials are saying it's too early to draw conclusions about whether the virus is continuing to spread. And there remain thousands of unvaccinated young children still vulnerable to polio virus. You know, polio had been eradicated. We've got to do better with this. It's easy to get caught up on your polio vaccine. It's a shot. It's given to infants generally at 2, 4, and 6 months with a booster between 4 to 6 years. Now, if you're traveling to New York City, do you need to worry about getting a polio vaccine? According to the New York Department of Health, the answer is no. But if you're unvaccinated and you're going to be spending time in the areas where the polio has been detected in wastewater, you should talk to your healthcare provider and really consider getting your vaccinations up to date. Okay, that's my message today. Good news, good news, good news. Take care, folks, and be well.